Welcome back to Insight. We're here in Goshen at Goshen Center for Cancer Care, which is a great choice for a second opinion, but they do so much so well that we want to talk to Dr. Vaghefi about your specialty, which is radiation, correct?
That's exactly right. I'm a radiation oncologist.
And so you're treating cancer through radiation, and what are some of the things that excite you in this field? Because there has to be new improvements all the time.
We're so excited, especially about all the things that we can do in radiation oncology. In the past few years, we've come up with a lot of different techniques and tools that we can use to treat our patients with prostate cancer and other types of malignancies. In radiation oncology, we can use conventional radiation therapy. These are things that we've been treating patients for a long time, and really we can give good results and get good results with this. In addition to that, we have newer techniques that can allow us to pinpoint our target and really give radiation to the target without affecting normal structures. And that way we can minimize side effects to normal structures, and that way we can minimize complications in the future. In addition to that, we have techniques that we can use to put radiation really close to the cancer, and that way we can kill the cancer cells without, again, affecting normal structures.
If by now people haven't learned that when we come to Goshen, you're part of a team. That your approach is, maybe you're going to be the lead in some cases, maybe you're going to play more of a secondary role, that it's really treating the patient and their specific case, and that's kind of where you come in, right?
Absolutely. Here in Goshen, our approach is really patient-centered. We're all working as a team, really with the patient in the center, and we all work around the patient to make sure that we really address patients' needs. These days, we do a very good job in curing a lot of cancers with radiation, with chemotherapy, hormone therapy, and surgery, but we know that we can cause other issues for the patient, and here in Cancer Center, we have a lot of other players, other team members who can actually help the patient not only go through treatment, but later on in healing and recovery process.
Talk to me about some of this, how you said you can target things. I'm thinking of like my dentist, when they do the x-rays, how it's almost like tooth by tooth. It gets really precise.
Exactly.
A lot different than obviously, they used to do.
Sure. Great way of looking at it. Here, we know that, let's say, take prostate cancer, for example. Prostate cancer is a disease where the prostate gland is affected by cancer, but the prostate gland is surrounded by normal structures such as the bladder, rectum, bowel, and other organs and other structures that have to do with other functions like the sexual function, bladder function, and so forth. And those are very important for us. We want to make sure that we preserve those organs and those functions so in the future patients don't have side effects. So by targeting, getting back to your question, what we can do is that we can see our target, and we can really, by advanced technology that we have here in Goshen, we can really pinpoint those structures and really not affect the nearby structure. That way the bowel and the rectum and the bladder get very minimal dose of radiation therapy, and this way they're spared. And thereby we don't get side effects in the future.
Yeah, that's just an amazing technology, and obviously it's so far advanced, and it's all really in your mind, not just how the patient is treated, but how they recover and what their life looks like afterwards.
Absolutely. Here, our focus is not only for curing the patients with cancer, but also in the healing process.
Want to learn more, go to livestouch.com. Goshen Center for Cancer Care. We'll be right back on Insight.